Hello, my name is Miranda Willannon. I am a student pursuing my Master's of Science in Nursing with a specialization in nursing education. I am here to talk about becoming a certified nurse educator. We will discuss the certification itself, the requirements for it, how the certification can impact the design and delivery of culturally responsive advanced nursing practice, how the certification can improve meaningful communication within the healthcare workplace as well as the educational setting. And then we will also talk about how the certification can support leadership for sustained change within education. The primary resource that I utilized was the National League for Nursing because this is a certification through them. So that's the primary resource that I use to obtain my information as well as others. First, let's talk about becoming a certified nurse educator. According to the National League for Nursing, the certification was created to help establish nursing education as an actual specialty of practice. So this would allow certified nurse educators to share their knowledge with one another and have a resource to utilize within nursing education itself. It helps one recognize various factors such as how to facilitate learning and teaching within different learning styles. That way we find what works best for certain student or patient populations. There are three main areas with this certification. They are academic, clinical, academic, and novice. So the biggest thing is that for the novice nurse educator certification, it is only for those with less than 3 years of nurse educator experience. And it's actually only valid for 3 years, and it is non-renewable. While the other two certifications, the academic and then the clinical academic, are 5-year certifications, and you can renew them based on going through all of the requirements. So the requirements of becoming a certified nurse educator is that you must be a registered nurse with an active and unencumbered license, and you must hold a master's degree or a doctorate in nursing education. Those are the primary requirements, but of course there are other avenues that people pursue their education. So if you do not have a degree that emphasizes nursing education, such as one that is like a nurse practitioner where you're clinical, or something that's more in a leadership category, you must be employed at your academic institution for at least 2 years within the past 5 years, because it is a 5-year certification. So you need 2 years within the past 5 in the academic setting if you do not have a nursing education background for your degree. For the actual certification, you must complete the requirements listed, and then you take an exam that is administered by the National League for Nursing. This exam is 150 questions, and it is renewed every 5 years. Something that I found that was awesome is that you can now do that exam online with online proctoring versus going to a testing facility to take it. It's actually available online with an online proctor now. So that makes it much more accessible for everyone, for those interested in pursuing nursing education. We are short on nurse educators, and we're expected to need more soon with all of them retiring. So this would be a great certification for someone that's interested. This certification helps to impact design and delivery of culturally responsive advanced nursing practice by creating educators that care about educating others about important topics in our field. It helps to test for the test itself will test for facilitating learning, as we already talked about, and discuss how to best communicate and share this education with others. Especially in the U.S., this is important because we are a melting pot, so it is important to provide culturally competent care since we have a blend of cultures throughout. So having this certified nurse educator, we're able to share with other nurses how to become culturally competent nurses. That way we are culturally responsive as well. By knowing how to find information related to cultural competence, certified nurse educators will be able to spread that knowledge to the best of their abilities to others within the healthcare field. It is also important to note that the certified nurse educator must be best equipped to educate the culturally diverse population and have education and resources to structure different assignments and educational techniques that best fit those that they are educating. So these are the ones that are best suited to address cultural humility and create proper interventions to address the cultural diversity within the educational system and within healthcare as a whole. With this certification, it will improve meaningful communication within the healthcare workplace and the educational setting. So in the healthcare setting, a certified nurse educator can work as the role of nurse educator on a unit. An example would be a nurse educator within the emergency department, so they would be able to help assign modules that perhaps the nurses need further training with, whether it's from evaluating charts or just from talking with the nurses and being that resource to them, talking with them, what do they feel like they need? So the nurse educator would be able to assign them different modules and serve as that resource. They could even provide workshops for them if the education needs it. Under this role, one could help to engage in scholarship activities for those willing to pursue their education as well. Then, if we want to look at the institutional perspective within education, a certified nurse educator is able to help facilitate learning in the classroom, lab, and clinical setting. They are prepared to help students and determine best strategies for their learning. They may also participate in curriculum design that serves as a pathway for learning, and they're the ones able to evaluate this as well. They will have meaningful communication techniques when they ask questions and provide both positive and negative feedback. They may familiarize themselves with different methods to share negative feedback as well. So an example of this would be the sandwich method of feedback. So this is where you tell them a good component, and then you tell them that bad component that they need to start working on, that they're lacking on, and then you tell them another good component. So you say one good, one bad, and then another good. That way the negative comment is sandwiched in the middle, so that they're not completely broken down by any negativity that might arise based on what you're communicating to them. So the certified nurse educator would be able to find techniques like that work best for them to encourage students to continue on to be the best nurses that they can be. The certification will help support leadership for sustained change within the educational setting. So this is through continued education necessary to remain certified and being relevant on current scholarly articles and news, different things that are coming out, for example, like TPA versus TNK use, and being able to educate others on TNK and why we might want to use that over TPA. Different things like that, just staying relevant. That way we can educate others on new findings. By continuing education with this certification, one will be able to continue to share the best educational strategies and techniques to sustain education within the department or the classroom setting. It supports leadership by creating nurses that are receptive to educational strategy and needs within the workplace. So a healthcare example of this would be a nurse educator within the emergency department creating workshop trainings that focus on stroke education, as well as helping the nurses obtain necessary stroke certifications for themselves. That way they can identify strokes, treatments, and interventions sooner. Maybe the nurses want to know a little bit more pathophysiology behind strokes and, where different ones are located in the brain and what they can expect. So the certified nurse educator would be able to help teach them about those things. From a leadership perspective, this will help nurses be prepared to tackle these situations and help one another, as well as take care of patients more efficiently. So they will feel more confident on the job, So with that confidence, it's possible that they might even like the job more too from that leadership's perspective. From an educational institution perspective, a certified nurse educator will have knowledge regarding curriculum design and evaluation, being able to recognize what is working for students and what might not be working for students. This will allow them to facilitate change and be a change agent within the institution. So I hope that this discussion helped make you want to become a certified nurse educator, as it is really enlightening to me, and I hope that I also become one and get that certification after I finish my degree. Thank you.